myeloma is basically a blood cancer, and it is a disorder of the plasma cells, which are a type of blood cells that produce antibodies. So this particular cancer affects primarily your bones because the cancer erodes through the bones, and it also affects your kidneys, where because of the large amount of protein that is being produced and the large amount of calcium that is being released. Basically, myeloma is a disorder of an advanced stage. So, as the age advances, the risk of having a myeloma increases. It is also seen more often in the male sex more than the female sex. The risk of certain other risk factors, such as industrial exposure to chemicals, to some extent smoking. Once the signs and symptoms have established, that means the disease is pretty well established. Because of anemia or a low hemoglobin, patient will have fatigue or tiredness, lethargy, easy fatiguability. Patient will be like tired doing the daily activities. There will be nausea, there will be vomiting, there will be constipation, and also mental confusion. All this will be part of the hypercalcemia, the calcium which is released. Also, because the bones are being involved, there will be bony pain, severe bony pain, especially along your chest or along your back. Because the kidney failure may occur, then you will also have symptoms of decreased urine output and also mental confusion once the kidney failure sets in. Apart from this, there are also other symptoms like your weakness of your lower limb, and there will be paresthesia or different sensation along your lower limb, or a lack of sensation in both your lower limbs. That will be a sign of one of your vertebrae or your spinal fracture, which will lead to the compression of the spinal cord and can lead to paralysis. So this can occur in severe cases of myeloma. More common tests that are being done is the serum protein electrophoresis. The plasma cells are secreting an abnormal protein that can be detected by a test called serum protein electrophoresis. There will be tests such as your bone marrow test. A bone marrow test is a test that they will put a bone marrow needle down your back, near your back spine, and in your hip bone primarily, and will take a piece of the bone marrow biopsy. So in that bone marrow, you will find abnormal plasma cells or the cancerous cells. In the imaging aspect, your conventional X-rays can also reveal if your bones are weakened, but they tend to miss in around 10 to 15% of the cases. Hence, in those cases, a CT or a PET scan, a positron emission tomographic scan, would be a better investigation to look for such bony lesions. Don't ignore any of the symptoms, especially the ones which we have discussed here, and to get medical attention as soon as possible, because that is one thing that is paramount. The faster that one gets to the attention of the primary oncologist or a hematologist, the faster the symptoms will be resolved and the higher chances of preventing any end organ damage. So it is a very treatable condition.